The difference between sadness and depression. Sadness is an appropriate reaction to a negative event. The difference between sadness and depression is that sadness isn't burdened with negative thinking. For example, if you lose your job, it's normal to feel sad. But if you think that losing your job means that you're a failure and that you'll never be happy, then you may well be experiencing depression. Because sadness is appropriate, it's temporary. When you're sad, you do things to pick up your mood. You can talk to friends, allow yourself to rest and sleep, do things that you enjoy, and there is a chance your sadness may get better on its own. Depression usually doesn't get better on its own, and it may get worse if left untreated. Depression can be understood by exploring certain criteria, and I would like to discuss 10 specific criteria. The first one is depressed mood. So this is when a person feels sad, down or depressed most of the time, crying more easily or for no apparent reason. The second one is a loss of interest, when a person loses interest in things that used to give them enjoyment. This can lead to becoming socially withdrawn and isolated. Thirdly, a low energy, feeling more fatigued or sluggish, and there may be a difficulty with getting going. Fourth, anxiety or irritability may be present. Also alongside it there may be worry, fear, irritability and intolerance. Fifth, a low self-confidence, so a person feels hopeless or pessimistic, and there may be a sense of increased guilt and worthlessness. 6. Poor concentration. This can manifest with difficulty in regards to concentrating or making decisions. 7. There may be changes in a person's sleep, so for example they may find it difficult falling asleep or staying asleep, and there may be an increase in wanting to sleep all day or not wanting to get out of bed, feeling very tired and not refreshed in the morning. 8. Appetite or weight change. So a person's appetite significantly lowers or increases for a prolonged period of time. There may be unintentional loss or gained weight, eating only because a person has to eat, but doesn't get any pleasure from food. 9. Slow moving or restless. So this can be experienced with movements that are slow alongside slower speech. Also restlessness and agitation may be accompanied. And lastly, there may be thoughts of death. A person may experience recurring thoughts of death or suicide, not just the fear of dying. Thoughts of would it be easier if I just didn't wake up in the morning may also be present. So you don't have to feel sad to be depressed. I guess this is what's confusing about depression. People often think they're not depressed because they're not sad. But sadness is not a necessary symptom of depression. People often manifest their depression in other ways. Depression affects your entire body. Everything slows down. You have low energy, lack of enjoyment and a high anxiety. The bad news is that depression is recurrent. Good news is that depression is treatable. So if you do experience any or have experienced any of the symptoms and criteria I have just talked about, please contact a mental health professional.